My name is Veda Fountain, and I'm going to be your student nurse. I'm with the University of South Alabama College of Nursing, and today I'm going to be doing your needle catheter insertion. So initially I'm going to walk in, go ahead and do hand hygiene, and then I'm going to provide privacy for my patient. So next thing I'm going to do is I'm going to grab my patient care order form, and I'm going to look at his identifiers right here and compare the two. So my patient is Jaguar Jones. Date of birth is 8/25/1963. Date of birth is 8/25/1963. My patient is allergic to penicillin, and according to his allergy ban, he's also allergic to penicillin, so this is the correct patient. After this, I'm going to go ahead and position my trash can. So I would have a trash can right near my foot, and also have my sharps container right here to my left. Okay, so after this, I would go ahead and make sure that my side table was at good working height, so not below waist level or anything. And I would also make sure to raise the bed to a good working height and lower the side rail down. Make sure that my patient is either in a supine position or sitting up. So once we're done with this, I'm going to go ahead and set my stuff up. So I have my tourniquet here. I have my little PP pad right here. I got my flush. I got my saline lock. I got a ChloraPrep. I got a alcohol wipe, my Tegaderm. Got my needle catheter, some gloves, and I have my tape prep down here. I have 2 pieces. Okay, so after this, I'm gonna go ahead and set things up, maintaining my sterility. Okay, so once this is all in here, okay, and the next thing I'm gonna do is I'm gonna go ahead and prep my saline locks. I'm gonna go ahead and wipe this down, throw this in the trash, and then I'm gonna go ahead and connect the saline flush. I'm gonna go ahead and prep it. Okay, so now this prep, I'm gonna make sure that it stays on top and make sure that it maintains its sterility. And I'm also gonna go ahead and loosen this little piece up here. Okay, so now once this is all loosened and everything, I'm going to go ahead and apply my tourniquet to my patient. Try to move this a little closer here. So what I'm going to do with my tourniquet is I'm going to place it approximately 4 to 6 inches above the site that I choose. So I'm going to choose his non-dominant arm. I'm going to try to go more distally, and I'm going to make sure that I don't try to go towards the ventral side of his wrist here. So I'm going to go ahead and prep this. Okay, and then I'm also going to feel for a distal pulse, and he still has one. So it's good, and he's got pretty good veins. So, I mean, they're pretty easy to choose. They're nice and bouncy. I don't really have to do anything like feel over them or apply warmth or anything like that. Okay, so once I'm done with that, I'm going to move this back just a bit. Okay, and then once I'm done with that, I'm going to go ahead and apply my clean gloves. Okay, and then once my clean gloves are on, I'm gonna go ahead and move my saline lock a little bit closer, make sure that all of that is prepped. And then once I'm done with that, I'm going to make sure that it's still in a sterile position. I'm going to go ahead and I'm gonna go ahead and put this little PP pad up under his arm here. Okay, good. Okay, so once I'm done with that, I'm going to go ahead and grab my ChloraPrep right here, and we're going to throw that in the trash. And I'm going to go ahead and prep it, so I would squeeze it, and then I'm going to find the vein that I was going to use, and then clean it for 30 seconds. You can do horizontally, vertically, and in circles, but you got to make sure that you clean it vigorously for 30 seconds. Okay, so once that is done, then we're going to move on to the venipuncture site. Okay, this is going to be my video for the IV insertion. So you're going to start off with clean gloves. You would have already cleaned the area, so we're just going to go ahead and get into it. So you're going to go ahead and grab your 20 or 22 gauge needle. Put the lid in there. You're going to go ahead and look at it, make sure it's bevel up. You're going to go ahead and tighten the skin. You're going to go in at a 15 to 30 degree angle. Whenever you get blood return, you're going to drop it and then go in another 1/4 of an inch. Once you get there, you're going to go ahead and advance the catheter. Once you get here, you're going to go ahead and pop the tourniquet. You're going to apply pressure. And then you're going to go ahead and remove the needle, place it in the sharps. Once you get there, you're going to want to go ahead and remove the top of the saline lock and directly connect it. And then once you get here, you're going to want to temporarily secure the saline lock in place. Okay, so once you get to that point, you're going to want to go ahead and aspirate for blood. So you pull back a little bit, see if you note any blood. If you do, go ahead and flush the system all the way. You're going to go ahead and disconnect this, put this in the sharps, and then once we're done with that, we're going to go ahead and apply our Tegaderm dressing. You want to make sure that you put it all the way up to the hub, like so. And then once you're done with that, you're going to go ahead and secure the J-loop in place in its natural position. Okay, like so. Okay, and then once you're done with that, you're going to want to go ahead and dispose of all your equipment safely. And then I'm going to go ahead and I would remove my gloves, but since we're going to discontinue, I need clean gloves anyways. I'm just not going to in this video. But I would go ahead and dispose of my gloves. And then after that, I would go ahead and get my label. I would go ahead and write the date, the time, and my initials, as well as the gauge of the needle. And then I would apply it above, not over the insertion site, but above the insertion site up here. And then once I'm done with that, I would go ahead and reposition the patient for comfort. So I'm going to go ahead and lower the side rails. I'm going to go ahead and or raise the side rails, lower the bed. And then I'm also going to go ahead and tell the patient or educate the patient on ways to prevent dislodging of the IV, or if there's any kind of complications to tell them to let me know. And then after that, I'm going to go ahead and just perform my hand hygiene. And then this is the finished product there. And then once we're done with that, now we're going on to documentation points. I'm going to go ahead and document the date, time, the gauge of the needle, the location of the needle, how many attempts it took, whether I used a saline lock or if I connected it directly to some tubing, if I use any kind of fluids, and also how the patient tolerated the procedure. Okay, so now moving on to desing the IV. So what you want to go ahead and do is perform hand hygiene. You're going to want to go ahead and put on clean gloves here. And then after this, you're going to want to go ahead and be very careful whenever you do this. I'm going to go ahead and remove the tape that secures the J-loop. Trash it there. You're going to want to go ahead and have your gauze ready and also a piece of tape to secure it. After this, you're going to want to go ahead and lightly remove the Tegaderm, making sure not to dislodge the catheter. Once you get to that point, you're going to go ahead and remove the piece of tape that you held the catheter in place with initially, or the J-loop, and then you're going to want to go ahead and fold your gauze into fours, place it directly over the IV site, and remove the catheter parallel. Put this in your sharps container. Go ahead and hold for 30 seconds. You might need to hold a little bit longer if your patient is on anticoagulants, but for the most part, you can hold for 30 seconds, and then you're going to want to tape it to secure it, and then that's going to be your finished product there, and then that should be good for discontinuing it.